So students, this is a continual lecture of the tonsillitis. Here we are discussing about the pathophysiology of the tonsillitis. In the tonsillitis, bacteria enters into the tonsils, and after this antigen antibody reactions will occur. Due to this, increased blood supply to the edematous tonsils. What is edematous? It is like a swelling or a edema present into the tonsils. So first bacteria enter into the tonsils and antigen reactions will occur after entering of the bacteria. When antigen antibody reactions will occur, after that blood supply increase to the edematous tonsils. So after this tonsillar abscess will occur. Tonsillar abscess means it's like a accumulation or a collection of the pus just behind or back of the tonsils due to the entry of the just because of bacteria. So this is a pathophysiology of the tonsillitis. Now next move to the clinical features of the tonsillitis. First is pain in the throat. Pain in the throat in this disease, patients will feel pain definitely in the throat side. Next is dysphagia, and due to this pain, dysphagia problem, we can say when patient will suffer from the tonsillitis, patient cannot be eat normally, and the patient feels difficulty in swallowing or of foods and all. Next is chills, fevers, and cough. When patients got infections, then body temperature will also affect. And due to this, patients may feel cold or chills. And in some cases, patients having cough. And next is headache. Headache, which is a general features of the tonsillitis. And last is tonsils exudate. This is a figure of oral cavity. You can see here there are two tonsils, this one and this one. This is a uvula. Uh, uvula is present in the soft part of the palate in between. Uvula present, and in between, in the lateral side of the uvula, tonsillitis present in this figure. And in this tonsillitis, white patches or white spot we can see here. In these tonsils, white fluid accumulated in the response of the infection, or you can say like inflammation, or so this process is known as tonsillar exudate. Now next is diagnostic evaluation. First we will collect the history, but I'm not written here. First, if a patient will come in a hospital or in a clinical setup, first our work is taking the history, either primary source or secondary sources, whatever. First, we will collect the history from the patient. If the patient is baby and not able to give in a proper way history, then we will collect from the data from the patient's relatives, and that is also called the secondary source. If we are taking the history from the patient or a baby who can give the his or her data in a proper manner, then we will call primary source of the data. Next is physical examinations, head to toe examination of the patient we can do. And next is sign and symptoms. When patient will talk about his or her symptoms, what she felt, and about the sign, physicians will assess. And next is exudate, which is bacterial cultures and any others. In this laboratories, persons will inspect or detect any bacterial cultures or any other things. In the treatment of the tonsillitis, treatment or management of the patient with the tonsillitis is classified into the two ways. First is symptomatic treatment and second is causative treatment. And first, through the symptomatic treatment, in this treatment names suggest that according to the patient's symptoms we will give the treatment. According way of treatment of the tonsillitis is a causative, and causative treatment is related to the bacterial species. So in this bacterial species, we can give the penicillin. Apart from this, there are some few medications for the treating the patient with the tonsillitis. First is penicillin, second amoxicillin, azithromycin, erythromycin succinate, and last one is clindamycin. Main complications, first is sinusitis. Sinusitis is like a inflammation of the sinus. And the next is otitis media. It is otitis media means inflammation of the middle ear. And snoring in what happen, actually a sound wave occurs during the sleep. When patient is sleeping more, then snoring sound will occur. And next is peritonsillar abscess. Peritonsillar abscess in what happened, neck pain, fever, lymphadenopathy will occur according to if a patient will suffer from the peritonsillar abscess, then such types of symptoms will occur. And next is apnea. Patients may feel breathing difficulty when apnea will occur. And any other infections may be present due to the tonsillitis. So this is all about the tonsillitis.